In my show today, I talk to a renowned women's health expert, and oh boy, does she ever deliver. We talk about improving your libido, having better, more pleasurable sex. And yes, I am talking about more and better orgasms for women in all the different places. We get into vaginal health, dispelling the myths. And there are a lot of myths to dispel about taking care of yourself down there. And finally, we get into the immense benefits of hormone therapy. There's so much misinformation about hormone therapy. And honestly, you're going to be really excited about how it can be beneficial to you. Hi, my name is Andrea Miller, the host of Getting Open. I'm excited to welcome you to my show. Let's get into it. Dr. Cheryl A. Ross, known as Dr. Sherry, is a nationally recognized OBGYN, best-selling author, entrepreneur, and women's health expert with over 25 years of experience. She is the author of She-ology and She-ology, the sequel, and co-host of the upcoming Paradox podcast. Get that? Paradox. With sex therapist Tammy Nelson. A sought-after media expert, she has appeared on Good Morning America, Dr. Oz, and Inside Edition, and has been featured in People, Glamour, and the LA Times. Welcome, Dr. Sherry. I am kind of obsessed with you. I'm just telling you up front. Like if I give you like stalking vibes.
Well, thank you for having me. I'm so excited to be here.
Yeah, well, let me just jump in and say I loved She-ology. I learned a ton reading it and watching your socials, including I picked up a handful of stats that were notable and even revelatory to me. Here are just a few that stood out that I think will be helpful to set the stage for my listeners to know. Okay, guys, get ready. 10 to 20% of women have never orgasmed. Not judging, just keeping it real, putting it in context. Only about 20% of women orgasm through penetration versus having their clit stimulated. Only 1 in 5 sexually active singles use condoms regularly. Only 12% of men and 32% of women use condoms every time. Those over the age of 45 have the lowest rate of condom use. Good job for the younger set, right? The rate of STIs over the age of 45 has doubled. Almost done here, folks. 59% of women fake orgasms when getting oral sex or through penetration. Not making it up. Okay, this really blew my mind. 24% of men fake orgasms because they want to have sex. They want to get sex over with. Wait, what? How does that even happen? We can come back to that. Not like we're going to be talking a lot about the dudes today. It's mostly the ladies, but that shocked me. And then the one I really want to jump off from is you say that over 30% of women quit having sex entirely midlife. And I have to say, this is both a shocking and not shocking statistic. I mean, based on your book, here's the good news. Based on your book, a loss of libido, is not inevitable for women. You're very pro-sex, which I love. And I think there was a lady named Dee who is having like 3 to 4 orgasms per day in her 70s. And like wild stuff. Like, get a D.
Yeah, D's got it. D's got it going.
She's got to go into D. Well, and that's what I love about, I mean, honestly, you talk on your socials and through your book about things that are taboo, that are cringy, that are downright embarrassing with such a poker face. I'm like, this lady is so chill. Like, I love her. I want to ask all the embarrassing questions for you people, for my listeners who have dirty minds. I mean, we all do a little bit, right? And that's the whole point. And I love that's what you're urging your readers and your audience to do, to have these awkward conversations. I love that you normalize this stuff.
Yeah. You know, there's a vagina revolution happening. And, you know, when I first started with my books, back in 2015, when I started really writing, you know, there was so much to talk about that wasn't being discussed. And so I sort of, you know, created this idea of a vagina revolution, you know, really as this metaphor to start talking about women's needs, from healthcare on down, right? But healthcare encompasses so much, right? But the sexual piece is always where we squirm at our seat and have a hard time really discussing the issues. And, it's just this shame and taboo and embarrassment that we've just grown up with over the years. So it's been fun to really dive in and discuss these topics that everybody has questions about and are just afraid to ask. So it's been fun. And I'm so glad that you learned some of these statistics, because it gives us comfort and sort of a hug, like you're okay and you're not alone.
Well, totally. And to me, I share these stats for context and between your book, your podcast coming up, your socials, and our conversation, for people who identify with some of those stats in a way that says, oh, dang, I'm on the so-called wrong, I'm using air quotes, side of that stat. You provide so many solutions. And that to me is the good news, right? I mean, that's the whole point. Yes, I'm a big believer in benchmarking. It's like, okay, where do I stand, right? Not to judge, but it's like you just kind of want to know where you stand, like when it comes to certain things. And am I normal? Okay, if I'm in the minority or majority, whatever it is, then I'm empowered to do something about it, is how I feel. Yeah. And that, your whole message is about empowerment.
It's about empowering it. And because 50% of women never talk about, their vagina. When I say vagina, I mean vulva, vagina. And again, it's it kind of speaks to, we just aren't talking about it with our healthcare provider. And to that point, I mean, most of us, and I think it's up to 90% of women, want more education surrounding our genital areas and how that expands into, and not just sexual wellness, right? It's taking care of these areas. And I think that now that we're talking about the vulva and vagina much more openly and with less shame, we can expand that to common healthcare problems. And certainly issues under the sheets are always problematic. And we're always questioning, are we normal? And, and so I want to empower women. I want to create this movement of health and wellness, and to really create conversation and feel okay doing it, not feel embarrassed and normalize it.
Well, totally. And I mean, honestly, I was going to say, mission accomplished as far as getting out there and being on the leading edge. And I don't know if you go to many OBGYN conferences and so forth, but what strikes me is that if other OBGYNs picked up what you were putting down, right? And I'm guessing you think about that a lot, and you probably do talk to other doctors and help them feel like, hey, this is really a way to add value. And to me, like, you talk about, anatomical health and sexual health, but you also talk about relational health, which I think is so, like, you're connecting the dots in a way that really is helpful, rather than it just being, mechanical, like, okay, the mechanical piece, how does this work? It's itchy, it's dry, okay, fine. But what's the greater context, to me, is what's important. Okay, but I have to say this. I learned recently that the etymology of the word, you probably know this, but just for my listeners who don't, I only learned recently the etymology of the word vagina is sheath. Do you know this?
Yes.
Okay. So, meaning it was named in reference to something that contains an object, sheath, specifically a blade. In other words, women's sacred portals were specifically named in reference to dudes' dicks. I'm being a little crass here. So yeah, and which is like, it blew my mind. And I was like, how am I only learning about this now? So I use the word Yoni, which is a Sanskrit word. You probably know this. Again, hey, gang of Getting Open listeners. Sanskrit is for means womb or source. And so I like to use the word Yoni. I'm going to use it. You use whatever word you want. It's all in service to education and empowerment. But you also point out that so many women feel uncomfortable using the word vagina.
Yes.
That I just want to say, if you listeners, beautiful listeners, are uncomfortable using the word vagina, Yoni. Yoni's a good alternative.
Yeah. Yeah. The code name. I mean, there's, most of us, 50%, 60% use code names. Harry Potter, Tunnel of Love, Cooch.
Oh, wait. Harry Potter?
Harry Potter,
Tunnel of Love, Cooch. Okay, Cooch.
Lips.
Okay.
Yeah, I mean, and I think it's so important to use the correct anatomy, to use the right words, because even the word vagina, we used to reference the whole area down in the vaginal area, genital. So vulva is very different. I mean, she's a different girl than the vagina, and we kind of clumped them together in a way that was, furthering the confusion. I feel like we're moving in the right direction in all ways in women's health, and certainly in using the correct terms. But I think it's important that we, as mothers, as aunts, as, BFFs, we help each other in this movement and make sure that the right words are being used, because I think it's helpful.
Yeah. Well, for sure. And I mean, when I think of just how so many women don't necessarily know all the anatomy, right? And I think you talk about this as well in just really delighting in that part of us, right? And that is just something, and let me ask you this. I feel like in a lot of ways, social media has helped women. In addition to your work, a lot of others are out there, and then other like influencers, Gwyneth Paltrow and so forth, are out there really trying to change the dynamic around how women feel about their anatomy, whether they call it the vagina, Harry Potter, which I've never heard, and that's hilarious. Yoni, like you name it. But that to me, what you call it is important. Probably more importantly, personally, is how you feel about it. Like, do you look at it? Do you like it? Do you touch it? Right?
Yeah. And I'll tell you, my favorite group of patients to take care of are the first timers, because they're the most influenced by a positive experience. Whether, it's 16 or 19, the age that I tend to start seeing patients. And I may not even examine them the first time. I just want them to feel comfortable, to feel good about me. And then, if they're good with the exam, I'll pull out the mirror and we go over everything. And I think it's important because many people think urine still comes out of the vagina. And they don't really.
Wait, it doesn't? Sometimes, maybe.
I'm just kidding. The hole, the urethral hole, the exiting of the urethra.
Yeah.
But it's important too, because it's so important to know where your clitoris is. Like, that's our North Star, when it comes to intimacy. And women have to know their personal roadmap first. And they have to know what's normal to know what's not normal. And so pulling out that mirror, and it's not just that age group, believe me. I mean, I will show women in their 60s, and many of them will have a comment about, oh my God, I didn't know. But it's important too, just from a medical standpoint, because I think doctors, we're not even doing a good job at examining the vulva. It's inclusive of the labia, the little majora, the minora, the little lips. And it's important to differentiate all these certain areas, and even the clitoris and the clitoral hood, because you can have issues related to adhesions and problems that can affect your ability to orgasm. So knowing your anatomy is kind of step one in that process of learning your body, learning your sort of what is there, what it's for, and just to understand it so you can identify problems along the way.
Well, totally. And I just, again, I love how you make a case for, in a time when vaginal rejuvenation is really a thing, how you really sincerely invite women to embrace how they look, right? And there are some instances where there is something wrong, like it's not just how it looks, there is something anatomically wrong, and that can get corrected. But let me ask you this. In your book, She-ology, written nearly 10 years ago, you raised a red flag about the impact on porn on women's bodies and sexual experiences. I suspect it's even more concerning now. This much time has passed. How are you seeing porn-driven sexual experiences show up in your exam room from women who feel like they need to look how in terms of what they look like and in terms of what they should feel and sound like?
Yes, yeah. This is one of the chapters. The perfect V is what I called it. I was inspired by it when a young woman in her early 20s came to me and said that her male partner, told her that her lips looked like Dumbo ears. And she was devastated, and she came to me and told me this, with red cheeks and embarrassment. And truth be told, she had normal vulva. But the impact of porn is huge. I mean, at the time, porn was getting more visits per month than Netflix, Amazon, and it was Twitter at the time. Now it's X. Those views combined. And, we're looking at such a unreal, reality of what really happens between couples, what an orgasm should sound like, if it has to sound like anything, what the vagina, what the vulva should look like. And, young men start watching porn as early as age 11. So that impact has really spilled over, and it's still spilling over, unfortunately, because there is healthy porn. There can be very healthy porn. Amateur porn can be really fun to watch. I mean, there's a lot of porn that can be an additive under the sheets, but so much of it has really hurt and scarred so many men and women along the way. And I think it's the conversation of, what's normal, what's not. And certainly the violent forms of porn is, horrific. And there's a movement to really changing that narrative, to making it more honest and more true. And so the perfect V really was born out of this conversation. And I felt it's important, and I talk about it all the time with my patients. What is normal? Vulva, just like snowflakes. Everyone's different. Everyone, just anything in pairs. Our ears, our eyes, our breasts, testicles, they're different, right? Nothing that comes in two in the body is meant to look alike. And there's variations for different reasons. But there are those women that do have abnormal vulva. I had a 16-year-old who was on the swim team, and one of her labia minora, stretched about 4 to 5 inches. The other one was normal. And so she was on the swim team, and she would have to tuck it into her vagina, during, her swim meets, or anytime she had to put on a bathing suit, because it would bulge in the area of the vagina. And it was, in that instance, I mean, that is truly, a patient that needed a revision. But there are instances where there are abnormalities of the vulva, the labia minora, that do need revisions, or certainly over the clitoral area, there can be redundant tissue that can, sort of put pressure on the clitoris. You can't even see, find it. So there are cases where the word rejuvenation, I don't even like that word in this context, because to me, rejuvenation is, applying skincare to your vulva, right? But in the context of this conversation, there are women that do need, revisions of their labia minora or, vulvar area due to normal anatomical things you're born with that we can help you with. So,
well, but how many patients do you think you've seen over the years of practice? Surely in the thousands.
Yeah, definitely. 5,000, 6,000.
So I'm just trying to put a percentage here, because for some women in that instance, there was clearly something wrong. and I presume this young woman was able to have it fixed. But I'm wondering if the vast majority, there's nothing wrong. It's a perception.
Right. Well, and two, you don't have a lot of comparison for heterosexual women.
Well, exactly. Like you've seen 6,000 of vulvas.
Right. I get to, I see it all the time, but so I sort of know more what's normal. And some women come in with very large redundant vulva, labia minora, and they don't even have a complaint. I may ask you, have problems with exercise or sitting on a bicycle or during any sexual activity. Do the labia, come into the vagina during penetration? Or is there excessive itching or irritation? Because when it affects exercising, walking, that's other indications that the vulva, there can be something wrong from just an anatomical standpoint that's due to just the variations that happen in life. So it's important, okay. And doctors don't always want to bring it up either, because you don't want to create a problem, because some women are like, no, I've never had an issue. Other women will mention it, and I will say, well, this area could be trimmed a little and you might not have that problem. And I've done surgery on women in their 50s and 60s who, have the clouds parted when everything recovered, and they really didn't have any problems with exercise or sexual activity. So,
but how? Okay, sorry. Go ahead. Please finish.
Well, and doctors don't always. This gets into, we have a very broken medical system.
Yeah, no kidding.
We really do. And if the average doctor spends anywhere from 7 to 11 minutes with their patient, you're really not getting into a lot of the real problems that you might be experiencing, and certainly the ones that are a little more uncomfortable to bring up. So that's anything sexually that tends to really not be discussed enough.
Yeah, well, for sure. And that's, again, it's great that you're such an advocate helping women realize the kinds of questions they should ask, particularly their OBGYN or primary care physician. But when it comes to these kind of cosmetic surgeries that are principally because women feel like they need to look different to be attractive, how is that becoming more or less frequent? Is it pretty common? Because it seems like it's common, but it's hard to know what's really happening.
It's still pretty common because, even if you aren't having any problems, but you want to look good with the lights on in the bedroom, you want your vulva to look pristine. You don't want any redundancies. You don't want dark skin. You don't want hair. There's a list that a lot of women think. Because again, if they're looking at Jenna Jameson, on the latest porn, and her vulva, looks perfect, that's whatever your perception of perfect is. And it's sort of under the guise of, it's a male society. It's a misogynistic society that we live in. And what looks good and what looks appetizing or sexy, that again is our own perception of what normal looks like. And everybody, especially if you've had vaginal births, the vulva, the entrance to the vagina, a little stretched out. With aging, the vulva can become darker. It can sag a little. The perception of what the perfect vagina looks like, there's no such thing as a perfect vagina. It's and your confidence with your body and your vulva, I think, really leads that conversation and should hopefully grant you that confidence that there's no such thing as perfection. It doesn't exist. And, quite honestly, how perfect are men's genitalia?
Not.
No, I mean, right? A cousin called me and said to me, this new guy I'm dating, his ball sack is so saggy. And I'm like, well, I mean, everyone has, what does that really mean? We're all different, and that's normal. That's what we have to really remember. So comparing to porn has been hard, and we're really trying to re-educate and instill confidence in women about their anatomy, and that normal, and variation of normal, is sort of the benchmark of what we need to go by, that there's just no such thing. But I think comparing it to porn is really, we have to avoid that at all costs.
Yeah. And I mean, I feel like it's been so well studied and understood that what is really sexy is when you're confident.
100%.
Right? And that's self-love, right?
Self-love.
And that understanding. In fact, I read somewhere that some of the people that are perceived to be the sexiest they're not the conventionally best looking people. And often they have something a little bit different about them. Like maybe they're not perfectly symmetrical. Like to me, I think of it as just like owning it, right? But that's an inside job. And I feel like, to your point, not only is our healthcare system broken, but our system is broken. Like so many of us are looking for a quick fix, right? And especially with ubiquity of things like porn and comparison culture on social media, it's like it's so easy to take that snapshot and then say, okay, I need to conform to this conventional metric. And I say like reclaim your power, people. You know what I mean?
Exactly. But it all starts with knowing your body and loving it, and it's, especially, sex is so complicated. And I think, some of the statistics you were talking about, up to 20% of women have never had an orgasm. And I think that's why knowing your anatomy, knowing your vulva, knowing your clitoris, knowing it's 10,000 nerve fibers, it has a job to do. And you have to understand that job is a good job, and it's empowering to understand what makes you feel good and to achieve orgasm, so that you can explain to your partner what you like and what you don't. And women's voice under the sheets has never been louder, which has been great. It's been great to see it. And I love hearing women. And I always ask my patients, young ones, again, do you masturbate? Have you ever had an orgasm? And I get very mixed messages. So giving them the sort of green light to do it is a job that I enjoy doing, because I think it's step one into sexual wellness, and it's kind of a good way to know that this person is going to enjoy sex the rest of their life.
Well, and their bodies. I mean, I'm just looking at you smiling, because that must feel so empowering in a culture that has shamed women. I mean, not even just our culture, across the globe, for sexual pleasure, and all like the Madonna and whore and all that BS that has persisted. I mean, honestly, one of the great things to me about social media, yes, there's quite a bit of misinformation. I sent my dad a video the other day. It was like totally AI. I'm like, I can't believe this guy. He's like, oh, that's an AI fake. I'm like, oops. Sorry, Pops.
Yeah. I'm afraid of that, actually, Andrea. I'm afraid of what AI is doing on many fronts. But I think, we're as great as social media can be. There's a lot of misinformation that's perpetuated. And again, it kind of goes back to empowering us to really go to the right sources for our, questions, and get the right answers and make sure that they're accurate. Yeah. Well, but I feel like it's like if your mom didn't tell you, or your aunt didn't tell you, or you're not in a circle of friends that feel comfortable with these things, particularly if you were raised in a culture or religion that is, if you will, old school. It strikes me that
there has never been a better time for women to be more informed and more empowered. And, just going back to this whole business of what makes you feel good. I mean, I think a big conundrum for women is it's like, on the one hand, we want women to just love themselves like they are. I think as women, that's what we want. And yet it's like, get Botox if you want to get Botox, have reconstruction down there if that's what makes you feel good. You know what I mean? It's almost like, at least for me, I think I want the women that I'm close to love themselves, right? And yet, if what's going to make them feel better is a Brazilian bikini wax, let's not judge it. You know what I mean? So it feels like there's a healthy tension. And in part, given that we're seeing, I mean, I feel like maybe where I get a little agitated is what feels like impossibly high beauty standards that's causing women to not feel enough, right? Like you do you is to me like the best thing, but I feel like a lot of women don't feel like they can do themselves because they feel like they have to keep these impossibly high standards, which are also getting pushed by more and more porn, right?
Yeah.
It feels like that's a conundrum.
I mean, that is a cultural problem, that a lot of emphasis is on beauty. And it head to toe. Beauty and youth are two things that, as we age and as we go into menopause and perimenopause, like all of a sudden that youthful feeling starts to change, and it changes as a result of hormonal effects on our body. But I think, to your point, I mean, empowering and creating a lot of confidence in yourself, it is your power. It's your superpower.
Yeah. And then, again, being able to talk about these things to me is such a gateway to saying, okay, here's what I need to do to feel good about it or to feel normal. Let me ask you this. When it comes to, and you said there's good porn, there's certain porn that can be additive and complementary. How has porn impacted in your practice what people are doing in the bedroom? Do you feel like that's a good thing as far as opening up what can bring both more physical pleasure as well as more, if you will, and the kind of really good emotional intimacy that I think most couples want? Yes, we want to feel good in our bodies, but we also want to feel more connected.
100%. I mean, look, porn has its benefits. I mean, I think, you can learn from it, healthy porn, in a way that makes you more adventurous in bed. I think it, from different positions to different, ways to have foreplay. I think all that can be additive to what is sort of the bedroom environment. And that I like. And I think sexuality is morphed, over the years, whether you have two partners now and two partners together, polyamorous relationships are very common. I see that quite a bit with my patients that, come in, and they may come in with their partners and they just to get checked for sexually transmitted infections. There's just a whole new acceptance of open monogamy. I mean, is a whole nother topic. My partner in my Paradox podcast, Dr. Tammy Nelson, I mean, she writes about it, all the time, and how it can be healthy. It doesn't have to be something negative, as long as there's open communication. All these new sexual adventures can happen if it's done safely with safe sex and openness. If you are in with a steady partner.
Mm-hmm. Yeah, I mean, I think getting out of your comfort zone and it being safe is such a powerful way to explore parts of yourself and deepen the relationship. Okay, so your website offers help for better, wait for it, everybody, butt play, which I didn't expect. I'm like, wait, what? And by the way, so I don't know if you're familiar with the publishing company I started like 20 years ago. In one of it's called Tango Magazine. We started in print, and then we've been digital for most of that time. I remember we published an article on anal sex like 18 years ago, and it freaked people the F out. Like way back then, that was so taboo. And so you talk about it, offering, and by the way, Dr. Sherry has a whole shop on her website. So there's a whole bunch of good stuff there, but I've never seen this. So you have dilators to safely prepare the anus, improve function and comfort, and make anal sex more enjoyable. I'm like, that's so awesome for an OBGYN to offer that.
So this by dilators really were born because I was seeing women who had painful penetration. And it might have been because of menopause and they weren't having regular penetration. What's regular? Where, let's say the average couple has penetration sex once a week. But if you have it just birthday and anniversary sex, or even for that person, you know, who's not in menopause, but hasn't had a partner or hasn't had anything in the vagina for 6 months, the opening starts to collapse. Doesn't close up, but it gets smaller. I mean, that, you know, the vaginal tissue is elastic, right? So it stretches. And so if nothing's been in there, even my virgin patients, you know, why is it okay that your first sexual experience should be painful, right? So you can use a dilator. Well, what was available were dilators that you had to lay down for 20 minutes, a couple times a week, and they were very long, and you would just put it in the vagina and you'd lay there. So I was like, something is wrong with this. And so the woman that I used to get the dilators from, because I loved they were very soft and they were comfortable, high grade silicone. They were just perfect. But I thought, how come we can't create a wearable vaginal dilator? So this is how it started. So I she's like, as I called her up and I said, why can't we have wearable dilators? So one thing led to another. I put a base on it. I shortened it a little bit and I created vaginal dilators that you could put on and you could go for a walk or do the dishes or sit at your computer. So you weren't thinking about, I'm lying on my bed, stretching out my closed vagina, you know, so it just made it easier, more, you know, better compliant, user-friendly. And that's how the dilators were created. And then I decided to do them for the anus area because for the same reason, like 40% of people like anal play, whether it's with a finger, a dildo, a penis, whatever your pleasure is, but it shouldn't hurt. And because it's uncomfortable, I created the anal dilators for the same reason. And actually the anal dilators can be used for neo-vaginas. So for, you know, trans women who had a vagina created, they have to dilate their vagina daily, actually. And they have to lay down. So again, it was a practical creation that I'm glad I could put out there. Or if your partner has a very large girth on his penis, I created sort of a larger dilator that can help you not have to feel pain, because pain should not be part of sex unless you want it to be, right? But it's
just saying.
No judging. I mean, you know, I think it's that sexual activity shouldn't be painful. Or putting in, you know, tampons, or your first, you know, interaction with the penis. If you're a virgin, it shouldn't have to be painful. So it's the dilators are really for that purpose, and we don't really talk about them a lot in the medical space. I mean, again, 7 to 11 minutes with your healthcare provider, talking about sexual problems, libido, they're not, unfortunately, discussed enough.
Well, totally. And that's honestly, it I don't know what to say other than like, I'm glad we're having this conversation. I'm so grateful for the work that you do, because this idea that sex isn't important, or that 30% of women are ceasing sex at midlife, it makes me sad. for them,
Well,
right?
And to that,
I mean, not to judge, but it's like,
right.
for whatever reason, right? Because sex is like not only just pleasurable, it's like so good for you. And sorry, you finish, and I have another question for you. Go ahead, please.
Well, again, I think it speaks to, when you think about low desire, low libido, which is, affects 40 million women a year. It's, super common. And there's different categories of why when you really look at the why to it. But older women, that 30%, I mean, there's a real physical reason why, because estrogen, our superpower hormone, when we lose it, and if you're not taking care of the tissue inside the vagina, you become very dry. It's basically called genital urinary syndrome of menopause. And it affects probably up to 60 to 70% of women. It's a predictable problem that women experience because estrogen is a very hydrating hormone. And so when you don't have it, I mean, our whole body gets dry, but especially the vaginal tissue. And menopause is brutal on the vulva and vagina for this very reason. So there's dryness in the vagina, the tissue gets very thin and pale. You don't have any natural lubrication. So painful intercourse is very common. And if you think that up to 70 to 80% of women will have this condition unless they're using vaginal estrogen as soon as they're diagnosed. It's so important. I think every vagina over 50 should be using it because it's kind of skincare, skin, food, if you will, to the vagina in that it moisturizes and hydrates and really prevents this problem from happening. So that if the reason you're not having intercourse, 30% of women stop altogether is because they don't want pain. They don't want the pain that's related to it.
Well, do you feel like, is it, in your practice, is it principally due to the pain, or is it I'm bored, or is it I'm stressed out? I mean, because I would think there could be a combination of things that are leading to that outcome.
Well, and look, I mean, when you think about libido and you think about why is my libido low, there are many, many causes of it, right? I mean, for one thing, our greatest erogenous zone is above the shoulders, right? It starts in our brain, desire. So if you are having issues with your partner or financial issues, or your son's in rehab, you're stressed at work, you're not really wanting to have intimacy because it's just not part of the top 3 things on your mind, because you close your eyes to try to relax and enjoy it, to get excited about intimacy, but you have other things that are really crowding your mind. So, if you sort of go down the list of, let's really talk about the why. So you mentioned stress. I mean, stress is huge on why women aren't interested. I mean, it's hard to have an orgasm. It takes work. It takes concentration and being in that moment. So stress is a huge game changer. And chronic stress is a real problem, and it overlaps and invades relationships, certainly sexual relationships. But if you're having pain, any pelvic pain from dryness, or maybe you have endometriosis or any STIs, fibroids, I mean, there's a lot of reasons why you have pain during, intimacy. I mean, the hormonal changes are just one of that laundry list, but certainly a significant one for women, over 45, over 50, certainly we see those problems. So you sort of have to go down the list of really what's happening that's causing your low libido, and certainly any sexual abuse or trauma. I mean, these issues are huge. Like, we don't even think about how the PTSD from those types of problems continue for a lifetime, or any medications you might be taking, or if you are drinking. Alcohol is not really friendly for desire. May make you more comfortable.
I think you say tobacco use also. So let's rewind a little bit. You touched on estrogen as kind of our super hormone as women. I think it's good news. And I know you're a fan of HRT with hormone replacement therapy. What's your take on it? And how did you feel about the recent removal of the warning labels?
Yeah. Well, I'm a big fan of hormone therapy. As soon as your estrogen levels start to drop, in your 30s, really, we start to see the change happening. As does testosterone too. We can talk more on that later. But, as the estrogen levels start to fall and your ovaries start to produce less, it affects our whole body. I mean, there are estrogen receptors everywhere. In our brain, in our skin, on down. I mean, the obvious ones, hot flashes, night sweats, and mood changes, and heart palpitations, bone pain, joint pain. We're really finding out, it used to be 34 symptoms of menopause, and now it's, I think closer to 70 to 100. And I think we're really still working on what's the association of all these effects of estrogen. So when we lose that, we can give it back to you. We can restore what you have by simply giving you hormone replacement therapy. And we know that it reverses all these symptoms, and quality of life really matters. So, individualizing the care, starting women on hormone therapy, I think is so important because those symptoms affect our quality of life. And we can manage them. We can safely give them to you if you're low risk. You don't have any, obviously, breast cancer, or if you don't have any blood clot history, liver disease, and things of those sort. You can safely take them. And now there's no really endpoint. It used to be 10 years, but we really know that is no longer the case. So what was exciting, you mentioned the FDA, this black box warning on hormone therapy. It was such a relief because it opened up the conversation again. This black box warning now supports all the benefits of hormone therapy for women. And if we really go back to when it was put on, this was back on a study, that Women's Health Initiative study in 2002 that really misled a whole generation. It misled a whole generation, right? It was a very flawed study, from the average age woman that they chose was 63, which is way beyond menopause. A lot of them didn't have any symptoms. They were already high risk for a lot of problems. And the study stopped because it said, now women are at risk for blood clots and heart disease and breast cancer. And it was unfortunate because I think at that moment in time in 2002, everyone stopped. Doctors stopped prescribing it. Women stopped using it. And we're still trying to make up for this lost time. But the FDA did something wonderful because they all of a sudden, they looked at the latest studies. They looked at all of a sudden seeing that this was a flawed study. And they took off the black box warning. And we were so excited that this was happening. So we're re-educating again.
Yeah, no, it feels so heartening given the many, many, many benefits that hormone therapy offers. Let me ask you this. When it comes to hormone therapy, what is it? It's estrogen, but do you take it in pill form? Do you use a suppository? Do you use a cream? Will you just get into the mechanics?
Yeah, so hormone therapy. So ideally, you want to use the bioidentical forms of estrogen, which is estradiol. That's what our body makes naturally. Bioidentical simply means that. And there are different forms. The Menopause Society, which is really our go-to for recommendations, we always want to recommend using transdermal, which is the type of estrogen that you use on your skin. It bypasses the liver So that's safer for women. There's no risk of blood clots. It doesn't affect our lipid or triglycerides. It doesn't affect our libido. Versus estradiol, the pill form, which you take by mouth, it goes through our liver. And so those risk of blood clots are higher and affects our one of the hormones that affects sex drive. So ideally, you want to use a transdermal form.
The cream. Or does it come in as a gel or just a cream?
There's a patch form, there's a cream form, a gel, a spray. So there are different forms of it. And it's often driven by what your insurance covers. So my first line is going to be the estradiol patch that you change twice weekly. You put it on your skin, and so it's absorbed in a steady state through your skin. And if you have a uterus, you want to take progesterone. Again, there's a micronized progesterone, which is bioidentical. Prometrium, you take 100 milligrams usually to start at night. And the combination, because if you have a uterus, you need to protect the uterus. If you just took estrogen alone, you'd be more risk for precancerous cells in the uterus. So you want to take progesterone. And we know that the combination of estrogen and progesterone, they really help, and not just the vasomotor symptoms, the hot flashes, night sweats, and heart palpitation, panic attacks, but there's so many other effects on mood, on cognitive functioning. Brain health has been huge. Starting hormones, starting estrogen within the first 10 years of menopause, we know now has a decreased risk of dementia and Alzheimer's. And these are huge, benefits and heart benefits. And, when you go off, where you no longer have estrogen, again, with aging, there's a lot of overlap of things that are happening naturally, but also the power of estrogen and what it's doing on a blood vessel level, and how it used to make those blood vessels more flexible. And now all of a sudden you lose that, and why your risk of heart disease, it's a whole nother topic, but 1 in 4 women die of heart disease. That's what we really need to be talking about. And the gynecologist, that's part of my job, is to educate women that 1 in 4 will die from heart disease. It's more common than all the female cancers combined. And how being on estrogen is protective against heart disease in that way. And it's helpful in brain health and protective against dementia. And what it's doing to our bones. And of course, the basic things that we know about, but we're finding new benefits for muscle strength, for mood, for cognitive. It's all these things make our quality of life so much better.
I'm like just over here. For those of you who can't see me, if you're just listening, I'm smiling from ear to ear, right? The number one cause of mortality for women is heart disease, right? So that there are all these benefits, and that, again, between the black labels being taken off or the warning labels being taken off, and passionate advocates like you are out here helping us women understand the many more benefits, I think, than most of us realized, is, to me, really exciting. But let me ask you this. Is like the cream form of estradiol? How do you pronounce
Estradiol.
it? Estradiol. Does that give you all of those other benefits, or do you need to use a more aggressive form and then use a progesterone to balance it out?
No, you can use, for example, the patch has different strengths of estradiol. There are cream forms that you can use that have, there's sort of an average dose that's recommended. So it's usually 0.05 milligrams of the patch. There's a lower dose, and then it goes up higher as well. So this is the dose that's going to afford you all these benefits that we just were talking about. But sadly, maybe, I don't know if it's 8% now that are using hormone therapy. We're really trying to generate the movement of safety and trying to re-educate and make up for this study that crippled us for so long. But,
for a generation. Yeah.
Really, it's like 2 generations that we're trying to re-educate. So it's happening slowly and surely, but I think our voices, we all have to collectively speak and be heard, and to disseminate the right information so women feel comfortable and confident. And the medical community also has to get back on track with current healthcare recommendations when it comes to perimenopause and menopause.
Right. So, okay. So if you're taking it at the higher dose, you have to take the progesterone. If you take it at the lower dose, you don't need the progesterone. Is that right?
You still need to take it. Yeah.
You still need progesterone to balance out those hormones.
If you're taking even the 0.025 of the estradiol patch, or, pill form, if it's a lower dose, you still need the progesterone. And also progesterone, we know, is also helpful. It's not just for protecting the uterus. We know it has a lot of benefits with mood, balancing your mood, and bone health, and other areas that are equally important. So helps with sleep too. So it has other benefits that we know about. And we're venturing now with testosterone. We're trying to re-educate women on the benefits of testosterone as well.
And I'm going to do, if you have a few more minutes for me, speed round of some questions. And I have a question for you about testosterone. But so at those higher levels, you need the progesterone. But there's some women that just use the 0.01%. Does that do enough for you? Do you feel like to be worthwhile of the estradiol?
So even the lowest dose that's available, you still need to take progesterone to protect the uterus. Now, we're using a low-dose estrogen cream called estriol on the face. Now we're using it very comfortably again for, if you think about what estrogen does for the vagina, right? It's important to hydrate, moisturize, increases blood flow inside the vagina. On the face, we're using it topically to improve fine lines and rehydrate, moisturize, and bring back some collagen to the skin. So it's, again, estrogen has so many health benefits in different ways, but for the benefit of menopausal symptoms, if you're on estrogen, you need to be on progesterone if you have a uterus.
Okay. That's super. I mean, honestly, thank you. I feel like there's so much misinformation out there. And when I listen to you talk about and connecting the dots from other sources that I've heard about these really exciting benefits. I mean, my mom suffers from Alzheimer's, and I don't think she did any. I mean, I know she didn't do any hormone therapy. And it just makes me think, oh, the outcome could have been different for her. And, the heart health and all these things. And even circling back to what we were talking about, this large portion of women who don't have sex because it's painful. When I think about just like, okay, we don't want, we want to minimize the hot flashes. We want to minimize our emotional dysregulation and so forth, these other many menopause symptoms, but just the feeling of being lubricated and being able to enjoy sex again. It's like, hello. Like, let's do that.
And it's exciting. Even our breast cancer patients can safely use vaginal estrogen if they're stable. Because again, this group of women are even suffering more, and they're so fearful. I just saw a patient today who, 63, she's dating, and she's like, I can't even have anything in my vagina. And I said, we got to get you on vaginal estrogen, and there's studies to support its safety. So it's just slowly but surely educating women and making them feel comfortable that they're safe. She just was so excited. So excited. So
all part of the vagina revolution, Dr. Sherry.
Absolutely. It's all part of it.
I love that. Let me ask you this. Since you're an LA-based doctor, you count many A-list celebrities and musicians as your clients, from Reese Witherspoon, who wrote such a beautiful foreword in your book, to Brooke Shields, Catherine McVie, Christina Applegate, Jane Seymour. So many more incredible women had incredible things to say about you. And in your book, you talk specifically, well, you actually urge women to not look at Hollywood for their fertility cues. You specifically mentioned, just because some celebrities in their 40s and 50s can get pregnant. I think you mentioned Janet Jackson, Halle Berry, maybe others. What I'm wondering about is what else, because you straddle taking care of famous women as well as normal women. What else do you want all women to know about aging, libido, menopause, even beauty? We were touching on this at the beginning of our conversation.
Well, first of all, everyone's famous in my eyes. I hate to differentiate, honestly, because all women are famous in so many ways. I think with aging, it's just embracing aging more and not being afraid of it, not running from it. But understanding that with aging, there are remedies with aging that can make the transition and make this our best second half, because things are going to happen that are just natural with our muscle mass and the way our bodies and fat distributes in different locations. It all kind of comes into the middle. But there's lifestyle changes that you can do, in addition to hormones, because I'm a huge proponent of women, if they have any disruptive symptoms of menopause, taking hormone therapy is so important, and don't be afraid of it. I think lifestyle is part of this conversation. We always say genetics loads the gun and lifestyle pulls the trigger. So it's a great metaphor for, eating a good diet. Mediterranean diet is going to help you with preventing diabetes and high blood pressure and obesity, things that are going to contribute to heart disease. So we can minimize some of those risks that we know 1 of 4. 1 of 4 women are going to have heart disease. So eating a healthy diet is going to be helpful in that way. Getting, 150 minutes of exercise a week, just simply walking, is good for your brain. It's good for controlling your weight. It's good for sleep. Minimizing, and speaking of sleep, trying to get 7 to 8 hours a night is so important. A night without sleep is a day without perspective. All of these things that we can do little by little that are important, minimizing, controlling stress, are just important for healthy aging. And using medical treatments that kind of improve your quality of life, improve your health. And I just think it's an ongoing conversation that we can have with ourselves personally, with our partners, and with our healthcare providers, to make aging not a negative, stigma that life is going to only go downhill. Because I think our best act is the second act. Because we're now more confident, we're more empowered. So that's the messaging that I like to encourage with my patients.
Yeah, I agree. And I feel like just listening to you, so much is back to the basics, right? What did you say? Like diet, sleep, exercise, which is super in our control, versus feeling like, things have to be really expensive, or, you know what I mean? Like we need to have a fancy gym membership. Listen, if you want a fancy gym membership, be my guest. But I live in Colorado. I hike just about every day. That's my exercise.
That's great. Sounds perfect.
Yeah, for sure. Okay, I want to talk. You touched on it a little bit, but this also was eye-opening in your book. STIs. What do you wish more people knew about STIs?
Safe sex. Safe sex, I wish people practiced it more regularly, because it really means that condoms should be used if you're with a male partner. Condoms should be used with any vaginal or anal penetration. Sadly, safe sex is giving a blowjob with a condom on, really. Or if you are having oral sex with a female using a dental dam. The reason being is HPV. HPV is the most common sexually transmitted infection. And most of the time, men certainly don't know they have it. Up to 90% of men have it, 80% of women. The reason being there's no symptoms. Often the first time it's identified, it's on a pap smear. So it's very contagious. We know it increases your risk of cervical cancer. We're seeing increase of oral cancers from oral sex. We're seeing a decline now actually in cervical cancer because of people getting the Gardasil HPV vaccination. But we know it's linked to anal sex as well. So that's number one. But chlamydia, gonorrhea, syphilis, I mean, these are the ones that you can get. And people always say, oh, I've been tested, so I don't need a condom. The partner brings their STI, lab results. But HPV, you cannot test for. So that is why there's not a PAP equivalent for men. So they don't know if they have it or not. We have to assume they have it. So practicing safe sex is so important because, what we're seeing STIs, the fastest growing group of STI recipients are over 50, over 65. I just saw a stat that's the group that has almost, more STIs now than ever before because they're not even thinking about a condom. They can't get pregnant, of course, but there's a lot going on in these senior living homes.
Like you said, second half is better. Let's go.
A lot going on.
Yeah.
So, that I just can't emphasize that enough with my patients that, I always tell my patients, carry your condoms. I give them out in my office, put them in your purse, carry them in your bag, demand it because it can affect your risk of cancer so much, even if you got Gardasil. Because with HPV, there's so many strains and there's high risk and low risk strains. And now it does cover, I think, up to 70% of the high risk strains. There are many strains out there that you can get. So practicing safe sex is so important. And I can't emphasize it enough.
Yeah, no, I appreciate your clarity here. Right? Like you're not joking around. And it was really clear in your book. And I didn't realize that men can't be tested for HPV. I was like, wait, what? So what is the age group? Because I know I have two boys, they're 13 and 15. And so their pediatrician is recommending them to be vaccinated 13 and 16. And so at what point is it too late, for people who are starting to, have a different partner or so forth? If you're monogamous, okay, we're not talking about you people. But those who are, go ahead.
It's a great question. It's confusing. Back in the day, it was, 11 to 26. And I remember vaccinating a lot of my patients in their 40s, 30s who were recently divorced. And I said, science, it lags behind. So it can't hurt. Let's do it. And now they've increased the age to 45. And that's more too from a standpoint, Andrea, of insurance covering it to some degree. I mean, patients in their 50s, I'll still say it can't hurt to get it because it's still out there. So again, it is up to 45, 11 to 45 is sort of the age group that we recommend.
And for both men and women, not just because are men the dominant carriers or both? Is it equal?
They're pretty close, but I think statistically, last time I looked, 90% of men and 80% of women had it. But again, it's probably not accurate because we don't have the same way of testing it for men. I mean, if you have a wart on your penis and we biopsy it and it's HPV, okay, yes. We used to be able to put a solution on the penis that would bring out the HPV lesions, but it's really harder. It's not like a screening test, like a pap smear. You come in and we check you. I'm sorry, go ahead. Just please finish. No, we look for it on pap smears.
Okay. And what are you talked about, did you say risk for cervical cancer for women if they get infected with HPV, for, did you say throat cancer?
Throat cancer.
Having oral sex?
We're seeing oral cancers in the throat from oral sex. If you have HPV, be on the penis, and women, perform oral sex, you can get it in the oral cavity. Same with anal sex, and men, they're giving their female partner oral sex, they can get HPV in their throat. What's interesting is that in the gay male population, they get PEPs, the anus, and they get tested for HPV in the oral cavity for this reason. I wish that we had the same. Again, we don't have the science yet to be able to get to that step. But, maybe 10 years from now, we'll see it, because I think it's going to be important to know this information.
Okay. So Dr. Sherry, I just want to make sure I understood this. You said 90% of men have HPV and 80% of women. What does that mean? Does that mean they're carrying it, but it hasn't presented as a wart or as something that is contagious? What do you mean by that?
So you can carry the virus. You can be tested at, let's say you're tested in your 30s and we find it. And we sometimes see it on a pap and sometimes we don't. So like any virus, like herpes virus, sometimes you express that virus and sometimes you don't.
Got it. So then by getting the vaccination, if you're saying that 90% of men have it, 80% of women, then getting the vaccination, if people have been getting the vaccination for all these years, then why are those numbers so high? Or they get the vaccination and it reduces the severity of an outbreak, or reduces the likelihood
it protects you against some of the high-risk strains of the virus. So with HPV, there's hundreds different types of HPV. Some types, 16 and 18, we call HPV 16 and 18, are high risk or more prone to cancer, precancer cells of the cervix, where low risk, which we can test for too, are less likely to live in the cervical area and change sort of the makeup of the cervical cells to making them precancer.
Got it. Okay. This has been so confusing to me. So thank you. I'm like, okay, now I'm tracking. It's kind of amazing that Gardasil is the only vaccination out there for this.
Well, there's been others, but Gardasil covers more.
Oh, okay.
More of the strains. So I think the latest statistic of that it reduced up to 70% of HPV strains.
Okay, so you're advocate for getting it early, and if you don't get it early, get it late. Is that a fair interpretation?
I'm a fan of vaccines. I am. Certainly getting Gardasil, obviously before you're sexually active, is the best time to get it. But to say if you're over 45 and you're single again and you're on Match.com and you're going to be out there, I think to consider getting a vaccination for HPV should be a conversation. Certainly wearing condoms, making your partner wear a condom is the most important thing.
Mm-hmm. Yeah, no, like I said, I appreciate your clarity. Okay, speed round. I'm gonna challenge you to answer each of these in 30 to 60 seconds if you can. We're not going to gong you if you don't, though. Okay, I've heard it said, if you're not horny, you're not healthy. True or false?
I think it's false. I think desire, being horny, I think it ebbs and flows. I think it's just so dependent on where you are in life and who your partner is. I always think it can be reignited, but I think it depends on just where you are in life and how you're feeling about yourself and your body and what's happening around you.
Okay. You are a big fan of extra virgin coconut oil as lube and other things. Why are you such a big fan of extra virgin coconut oil? How should we be using it?
Love extra virgin coconut oil. It is a natural bacterial moisturizer. It's so healthy for the skin. It moisturizes so well. It feels so good. It's inexpensive. You can use it. That would be the one product I'd bring on a desert island because it has so many uses, from moisturizing to a great lube, and it's good for everything. Love it.
Okay. All right. You heard it here first, folks. Okay. Be honest. Are most women overwashing their vaginas?
No. First of all, you don't need to wash inside the vagina. I always say it's like your oven at home. You don't have to clean the stove, but you have to clean the stove top. So we're talking about it's important to clean the vulva area. I'm all for it. I'm coming out with I have a personal wash that I made for the vulva that is really pH balanced, and it targets the skin, prevents dryness, it cleans it appropriately. And you should be cleaning your vulva every day.
Okay. And you're not a fan of douches, though, correct? Meaning the inside, cleaning inside, you don't need to do that.
No, because you're basically wiping away and removing the 30 plus organisms that take care of the microbiome, the community in the vagina that protect the inside. It's like the tears to our eyes. The discharges are cleaning mechanism. So you don't have to clean inside. Clean the entrance where the urine is, and of course the vulva, but you don't have to clean inside.
Okay.
And then very bad.
No douching. Okay. So much misinformation out there. Thank you for being so clear in your
I know. It's not good for you.
Yes, there's so much misinformation.
Infection from anyone.
Oh, that's just okay. Keep it positive. And now, as before your solution comes out, are there particular other brands that you recommend, or just whatever you're showering with?
Just unscented, gentle soaps are good that you can use on the outside, on the vulva. Unscented, your vulva doesn't have to smell like Maui. All those products that promise you roses and, a trip on the beach, just don't do it, because those are often going to disrupt the pH balance. This very delicate area, the skin of the vulva, is very sensitive and can lead to dryness, itching, irritation, and I don't recommend it.
Okay. Is it true that pineapple will make you smell better down there?
Yeah. Well, there's a list of foods that you can eat: pineapple, mango, kiwi. Different fruits are very healthy for the way the discharge can smell, just like asparagus is to urine, right? Certain foods, garlic, certain spices can kind of give a negative smell off your body, off your skin pores, very similar to vaginal discharge, to a male's ejaculate. So pineapple has a positive effect on what we exude out of our body, from liquids to discharge.
Oh my God! So finally, one of the what could have been a myth is affirmed over here, because there's so much misinformation, and if you spend a lot of time on Instagram or TikTok, it's just like the misinformation that you get from these different products, right? And even to your point, it's not even that they don't work; that they can disrupt your pH balance and damage those delicate tissues down there. Okay, so we're not doing that. All right, if it burns a little during sex, are we being dramatic, or is that actually a red flag?
It certainly could be a red flag. My first thought is always too dry. I love lube. It should never be thought of negatively. Most couples enjoy it together. It just helps with pleasure, and dryness can lead to burning. So that would be the first thought. The second thought is there could be an infection if you were adequately lubricated. So those are the first things that come to mind. But lube, everyone gets some favorite lube out there because it's so nice with sex.
Okay, so thank you for that. You talked about extra virgin coconut oil. Are there other lubes that you're a fan of, or just stick with what you can cook with?
Well, you can't really use an oil with a condom, because it will break down the condom itself. But I like a few lubes. I mean, Yes is a good one. Uber Lube's a good one too. those are good ones that I often recommend to my patients. I think it's just fun to experiment too, but those are my two favorite that I recommend right now.
So then, are those water-based?
They can be water-based. Uberlube's silicone-based. So you just pick which one you like. And Uberlube I like because I think it has good staying power. Yes comes in water-based and silicone-based.
Okay. All right. A couple more here. You'd mentioned it a minute ago. What is a vaginal microbiome, and are influencers wrecking them?
Oh, no. So the microbiome is just the community. The vagina likes to be acidic. That's how it works best. And there's about 30 organisms that keep the environment very clean and stable. And if you take an antibiotic, for example, or you're using that bath soap from Paris, or you have a very strong fragrant, whether it's a detergent or soap, all those things can disrupt that pH balance. It happens a lot, and we don't really think about what, common things from medication, antihistamines, alcohol, they can all affect that pH balance and disrupt it. So those are some of the more common things. And not just internally inside the vagina, but externally on the outside of the skin.
Okay. And I mean, you talk about it in your book, and it's gotten even worse in these last handful of years. Things like steaming. I mean, I don't know. I didn't even know the list, but it feels like there are a lot of exotic things that are being recommended by influencers. And you're like, yeah, that's not a good idea.
Here's what I'd say. Those things, the steaming and so forth, can it hurt? I mean, I don't know if it really could hurt it, depending on the temperature of the heat, if there's any, fragrant in that, steaming mist. Honestly, the best thing you can do for your vulvar skin is to moisturize it. My whole mission is to treat your vulva, your genital skin, and men too, like we do our face. It's equally as delicate, affected by things we eat, the weather, medications, all these other disruptors that I was just talking about can cause dryness to the skin. Dryness of the vulva can cause itching, irritation. It disrupts intimacy, exercise. And if it's kind of what I always say, predictable, it's preventable. So keeping that genital skin moisturized and cleaned every day is very important. And we're just leaning into this conversation because we can and we should. And I think, again, it's just educating, empowering, and having you understand the why.
Okay. So Dr. Sherry, if a woman is listening who isn't on hormone therapy, how do you, I mean, cleaning, yes, totally clear. How do you hydrate down there then?
So similarly, on the outside, you can use a moisturizer, and hopefully you'll be using mine at some point.
Bring it.
You can use coconut oil. Again, extra virgin coconut oil, which is the basis of my moisturizer, you can use in the shower on damp skin. You squirt some fractionated coconut oil, your skin's damp, rub it on the outside of the vulva. It's very soothing and hydrating. So that you can do, that's easy and very cost friendly. And the dryness inside, vaginal estrogen all day long. Everyone over 50, please get some. It's very safe. It's kind of keeps the skin inside the vagina very hydrated, moisturized. It protects the bladder from other symptoms that you will get because there's estrogen and lack thereof affects the bladder. Urgency, frequency UTIs are very common as we age. Again, if it's predictable, it's preventable. So these are things you should just start using, talking to your doctor about. Find a doctor that is well-versed in menopause. It doesn't have to be a menopause certified practitioner, but it can be someone that is knowledgeable. Look at Yelp reviews, talk to your girlfriends. There are a lot of choices out there, and use them, find them, and you'll be so happy you did.
Yeah, I love that. Okay, last two. If you could ban one thing from the feminine hygiene aisle today, what would it be?
fragrant soaps or fragrant products that claim to make your vagina smell good.
Okay. All right. And then last one. This is a layup. How important are Kegels?
Oh my God. I just did 10 as we were sitting here. Kegels are so important. Your pelvic floor, which is affected by childbirth, obesity, coughing, aging. Those pelvic floor muscles support your uterus and bladder and vagina. Doing those Kegel exercises, 1,000, 2, 1,000, holding them for 3 seconds and doing them like you do any muscle, right? Any muscle. You want to strengthen that pelvic floor. The best way to find it is to pee, stop your flow midway, hold it for 3 seconds, let your urine go, and that's your pelvic floor muscles. That's how you can find them. Doing 10 reps at a time, 5 times a day. You're never too young to do it. It will really help you in the future with urinary incontinence. It helps with orgasms. They're just good to do. And I can't emphasize that enough.
I love it. Yeah. Well, let me ask this. You said you're never too young to do Kegels. Are you ever too old to do Kegels?
Never.
Okay.
Never. It's Kegels are really important.
Yeah. And I interviewed, you probably know Dr. Laura Berman. She lives in your neck of the woods, right? I remember I was interviewing her on her wonderful book, Sex Magic, and we were talking about Kegels. And she said the same thing. She's like, I'm just doing Kegels right now. I'm like, wait, what? Now I'm doing the same thing. Like I just sit there in my car or wherever. And it becomes like, once you start doing it, it's like, oh yeah, I can do that right now. I'm like on a phone call or, standing in line or whatever. Oh my goodness. Love it. And again, so many benefits that I just feel like, it's great to have your advocacy. Dr. Sherry, we covered a lot. Is there any last thing that you feel we didn't cover that you want my audience to know about?
No, listen, I think it's that these conversations, we need to really change our approach and the perspective to how our bodies function, women's health, and empowering our voices to, not feel shameful about anything related to our health. And we need to talk about those sensitive topics and do it in a way that's comfortable. Find someone you can have these conversations with, and it will really help everything to do with aging and hormonal changes that all of us go through.
I love that. And I find often in my circle group, you probably won't be surprised that it's like, okay, I'm going first, right? And like somebody has to go first. And so just to really drive the point home that so often people are so grateful that somebody took the initiative, right? And then maybe it's cringe and then you can make it funny. I mean, I even just my boys are 13 and 16. I talk to them as their mom about a lot of stuff. And they're like, Mom, it's like, no, we got to talk about this stuff, kiddos.
Yeah, it's good. They'll thank you later.
Yeah, for sure. You've been an amazing guest, Dr. Sherry. Thank you so much. And I look forward to when you've got that new wash coming out. I want to be on your mailing list.
I'll let you know. Thank you so much for having me. Appreciate it.
Thanks. Ooh, I hope you loved that episode as much as I love talking to Dr. Sherry. So many actionable insights, gang. Whew. Thanks for tuning in. As always, if you aren't following or have already subscribed to the show wherever you get it, iHeart, YouTube, Spotify, iTunes, you name it, please be sure you do. My team and I bring it to you with our full hearts. We don't want you to miss an episode. Thanks for tuning in, and we'll see you next time.